If you're doing your Kegel exercises right now, chances are you're doing them wrong. I'm Dr. Nabila Noor, a urogynecologist and a pelvic reconstructive surgeon. And part of my job is to fix your pelvic floor every day. I do that in the office, I do that in the operating room, and I can't tell you how many women come to my office telling me that they have been doing Kegel exercises for years and nothing is happening, nothing is improving. But here's a fact. Most of these women are doing their Kegel exercises wrong. Instead of working on their pelvic floor muscles, they have just been clenching and straining for no reason. So let's get started and learn all about Kegel exercises. So let's start with what is Kegel exercises. So Kegel exercises are a special kind of exercises that is meant to strengthen your pelvic floor muscles. Your pelvic floor muscles are those muscles that help support your pelvic organs, things like your uterus, the bladder, the rectum, the intestines. Now, when we talk about Kegel exercises, many women just think about tightening and clenching and straining. Now, remember, your pelvic floor muscles don't just require flexing and straining, you also should be relaxing those muscles. So to do your Kegel exercises correctly, not only do you have to contract and lift, you also have to relax and breathe appropriately. If done right, Kegel exercises can help your bladder control, your bowel control. It can also help with intimacy. So why do I say that most women get Kegel exercises wrong? Here's what I see often when I see my patients trying to do Kegel exercises. Number one, they're holding their breath when pushing down. Wrong. Because when you do that, you put extra pressure on your pelvic floor, and that's not helping strengthening them. Number two, clenching your thigh muscles, your glute muscles, or your abs. Wrong again, because these are not your pelvic floor muscles. Your pelvic floor muscles are actually inside the body, which sometimes can make it a little bit difficult to identify. And number three, never letting go and contracting for their life. Remember, Kegel exercises is not just about contraction. It's a three-step process: contraction, hold, and then relaxation. And all three of those are equally important. I remember when I explained this to one of my patients, she laughed because she told me that she has been doing Kegel exercises, or her version of Kegel exercises, for the last 10 years. And she goes, Dr. Noor, what I've really been doing is tightening my ab muscles, and of course, no wonder things are not improving. So then how do you do it correctly? Okay, so here's how to do your Kegel exercises correctly. Number one, imagine you're trying to hold your urine midstream. The muscles that we engage to stop the stream of urine flow, and those are the muscles that you need to strengthen when you're doing Kegel exercises correctly. Number two, don't hold your breath. Breathe normally. This does take a little bit of practice, especially when you're first starting. The tendency is to kind of hold your breath as you're contracting or as you're relaxing. Try to get into the habit of trying to breathe normally while you're tightening and relaxing. Number three, contract those pelvic floor muscles gently. Remember, if you're not sure if you're using the right muscles, imagine you're trying to stop your urine. So the muscles that we use to stop our urine, that's the muscle that you want to engage. Imagine you're gently contracting it and lifting it, and hold it for 3 to 5 seconds. Number four, fully relax for 3 to 5 seconds also. Remember, it's contraction, hold, and then relax. And all three steps are equally important. So how often should you be doing it? Start with 10 reps, 2 to 3 times a day. You can do one in the morning, one before going to bed, and sometime during the day. It's not about quantity, but quality. So even if you're doing 10 repetitions 2 to 3 times a day, make sure they're good, solid, properly done Kegel exercises. It will take you a long way. You don't need 100 Kegels for years at a time. You only need a few exercises, but it has to be done correctly. So here's the twist. Kegel exercises is not for everyone. I have many patients who I see in my office who suffers with pelvic floor pain or pelvic floor muscle tightness or myofascial tenderness. These are patients who should not be doing Kegel exercises. So if you're somebody who suffers with pelvic pain or pain with intimacy or very tight pelvic floor muscles, make sure to be evaluated by a urogynecologist before you start doing Kegel exercises. Because for these patients, instead of focusing on strengthening your pelvic floor muscles with Kegel exercises, we actually want to focus on pelvic floor muscle relaxation, which is the exact opposite of Kegels. So again, if you're somebody who has pain with intercourse, pelvic pain, and oftentimes difficulty with starting a urine stream, get a referral to see a urogynecologist or a pelvic floor physical therapist so that they can tell you whether or not you have tight pelvic floor muscles. And if you do have tight pelvic floor muscles, then stay away from Kegel exercises. Now, one thing I often see my patients feel frustrated about is that they think Kegel exercises is the solution to all your pelvic health problems. Now, Kegel exercises and in general, pelvic floor exercises are great starting points, but they're not a solution for everybody. So if you're somebody who's been suffering with pelvic floor issues, whether it be urinary issues, bowel issues, pelvic organ prolapse, or even pelvic pain, and you've been doing Kegel exercises and things are not improving, don't waste your time any longer. Go see a urogynecologist. It's time to look for a different treatment option. Many times we can look into other conservative treatments, and if appropriate, your urogynecologist can also talk to you about some surgical techniques which are truly minimally invasive. But for the right patient, it can be a total game changer. So please don't suffer. Pelvic floor issues, while common, are not normal. So get the help that you need. So have you been doing your Kegel exercises correctly? Or have you been working out your ab muscles instead of your pelvic floor muscles? The difference can make a huge difference for your bladder health, for your bowel health, as well as your sexual health. Drop your questions in the comment section. Let me know if you have wondered whether or not you're doing your Kegel exercises correctly and what have your experience been. If you like what you see, don't forget to subscribe to my YouTube channel, and you can also follow me for short content on my Instagram, as well as sign up for my newsletter at drnabilanoor.com. Remember, pelvic floor strengthening is not just about squeezing. Yes, we want to do Kegel exercises, but we want to do it correctly. Share this video with somebody that you think may benefit from learning how to do Kegel exercises correctly. And truth be told, all of us should be doing Kegel exercises, whether we are in our 20s, 30s, 40s, or 50 and after. Next week, I'm going to do another video where we talk about some early signs of pelvic organ prolapse and incontinence. So make sure to tune in. Until then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye.